COVID-19 1 year later. What have we learned? It's been more than a year since the first case of COVID-19 was diagnosed in the United States. And while we've been busy washing our hands, wearing masks, and occasionally scrambling to get toilet paper, remember that doctors and scientists have been working to understand the virus that's gotten us here. In the past year, we've made a tremendous amount of progress that's both overwhelming and incremental, said Paula Traktman, PhD, a virologist and professor of biochemistry and molecular biology at Medical University of South Carolina in Charleston. Overwhelming because who knew we'd be spending every waking hour thinking about this? And incremental because I don't think we've learned crazy new science about the virus, but we've learned crazy new stuff about the pandemic, she said. Here are some of the most significant questions about COVID-19 that experts have been able to answer in the past year, and a few that remain a mystery. What have we learned about where this coronavirus came from? A year ago, scientists theorized that this new coronavirus, SARS-CoV-2, probably originated in bats, then another animal passed it on to humans. That still appears to be the most plausible theory, according to a month-long World Health Organization, WHO, investigative report in China. For the general public, this might sound like the plot of a sci-fi thriller, but virologists aren't surprised. SARS-CoV-2 is actually a new flavor of a familiar virus, Traktman said. When you look at it, it tells a familiar story. There are actually 7 different human coronaviruses. The 4 milder strains have been circulating in humans for years and are believed to be responsible for up to 30% of common colds. But SARS-CoV-2 more closely resembles the other 2 potentially lethal strains, SARS, severe acute respiratory syndrome, and MERS, Middle East respiratory syndrome. What's been unusual is that SARS-CoV-2 has been much less lethal than SARS and MERS but much more global. It's gone on for what seems like forever, and it's had a really broad and durable impact. That's the news, Traktman said. What have we learned about COVID-19 long haulers? Typically, mild cases of COVID-19 last about 2 weeks. Trusted source, while people with severe cases may take up to 6 weeks to recover. However, about 10% of people who develop COVID-19 have symptoms that linger for months. There's a lot about these long haulers that still mystifies doctors. They're people of all ages, for starters. Some have no underlying health conditions, and some have been only mildly sick with COVID-19. Post-COVID-19 syndrome can also span a wide range of symptoms, from severe fatigue and brain fog to nausea, headaches, and loss of taste and smell. It's almost as if their immune system is still trying to fight something that isn't there, said Dr. Bradley Sanville, a pulmonary and critical care physician at the UC Davis Medical Center post-COVID-19 clinic in Sacramento, California. Some long haulers have 1 lingering symptom, while others have 15. That makes it hard to parse out what's going on and whether or not there's one unifying problem. We don't know if people will just get better with time and, if so, we don't know what the time frame is. It's tough, Sanville said. Over the past year, medical experts have been primarily focused on fighting the virus, but hopefully enough people get vaccinated and the spread of COVID slows enough so that we can take a better look at this group of people, Sanville said.